by turning it over to Lisa Kovacs, who is she's the program coordinator for the Indiana Hands and Voices Side by Your Side program. And like I had mentioned a couple of times, she's also a parent of a child with hearing loss who specifically has the auditory neuropathy diagnosis. So, Lisa, I'm going to turn it on over to you. And thank you so much for joining us tonight to share about your experience.
Sure. I'm glad to participate with our neighboring states. I'm Lisa Kovacs. Like Carrie had said, I'm the program coordinator of Guide by Your Side in Indiana. I'm the founding board member of Indiana Hands and Voices. We started the chapter, it's been 8 years ago now, in Indiana. And I'm also the director of Guide by Your Side for National Hands and Voices. So I help mentor other new Guide by Your Side programs. We have just added our 17th Guide by Your Side program in the nation, so we're very excited about that, and interest still keeps coming in from other programs. As Carrie mentioned, I am a parent. I have 4 children. I have a 15-year-old daughter, a 13-year-old daughter, and I have twins that are 11. And they are boy-girl twins, and it's my son, Anthony, who he actually has a severe sensory neural hearing loss as well as auditory neuropathy. He was born 3 months premature, and due to complications to the prematurity, his risk factors for his hearing loss are that he was given ototoxic medication, and he had an extremely low birth weight. And then his risk factors for his auditory neuropathy are that he had a toxic bilirubin level that required transfusion, as well as his extreme low birth weight. So his ABR shows auditory neuropathy. His audiogram, or his daily functioning, he functions a little bit more like a typical bilateral sensory neural hearing loss kid. However, we know that we have that auditory neuropathy component on top of that. He was diagnosed originally just with bilateral hearing loss, and it was actually not severe bilaterally from his first ABR, but there was a lot of, this was 11 years ago, and so they weren't diagnosing auditory neuropathy like as much as they are today. And so his first ABR left us with some uncomfortable feelings as a parent, just not really feeling secure about the diagnosis we received. So we went and got a second opinion and another ABR, and that's where they found the auditory neuropathy. And so our journey at that point, he was older because of his prematurity, was home on oxygen for a while, and back then they weren't doing unsedated ABRs, so they wouldn't sedate him until he was off oxygen. So he was not diagnosed until he was 11 months of age. We aided him right away. We chose to use amplification, and at the time, he just was a terrible hearing aid user. He, like a lot of parents experience, was constantly taking his hearing aids off to the point we caught him, trying to shove them down the register vents in our house. So all the parents on the call, you guys know what those days are like. But we look back now because we didn't have the auditory neuropathy diagnosis back then, and we are wondering if his reaction, it was a pretty severe reaction to his aids, was somewhat due to his auditory neuropathy. I'm not going to get really technical because I'm going to absolutely leave that up to Jean as the audiologist, because I definitely don't want to go out of my field of expertise. But I will say that Anthony's not classic auditory neuropathy because he does have absent otoacoustic emissions, where many kids who have auditory neuropathy, those otoacoustic emissions are present. And I'll let Jean explain that more. But because of his absent OAEs, once again, we definitely went through the hearing aid trial. And after we were able to find a setting that worked for him, he became a very good hearing aid user. In the meantime, we became friends with other kids with auditory neuropathy, and just a wide range of, there just seemed to not be one kid exactly alike with auditory neuropathy in the group of friends that I had made here in Indiana. Some were responding well to hearing aids. Others were showing absolutely no response to hearing aids. And to this day, my son is 11, and he gets huge benefit from his hearing aids. We did choose the listening and spoken language route for him, and he is in 5th grade. He has been on par with his language since about kindergarten, 1st grade. At age 3, I will tell you, he was still significantly behind. We were still kind of wandering our way around different modes of communication, and we finally found something that worked for him and found a school that was very equipped at developing listening and spoken language, and he just took off. It just seems to be how he was wired. And so I prefaced that by saying how he was wired, because we had other friends whose kids tried listening and spoken language route with their auditory neuropathy and really, really struggled and needed the support of sign. So once again, not any two kids of A and I have found have been alike. But for Anthony's journey, which is what I'm here to share with you guys tonight, he just took off, and since kindergarten and 1st grade has not looked back. Like I said, he's in 5th grade. He's on par. He's passing all standardized testing, and has really adapted to his hearing aids very well. I will say that if there was one thing that I wish that I could change, he does not function well in noise at all. He really breaks down in noise. We also have found, we did some really detailed testing to look at, it looks as if although his audiogram looks exactly the same bilaterally, both ears, when you test the individual ears alone, aided, speech discrimination, in noise and without noise, his left ear performs significantly poorer than his right ear. But then when you aid him bilaterally, his speech discrimination you can't argue with. I mean, he's in the 92th percentile. But his one ear, his left ear alone, drops to like 68%, and his right ear alone is much better. It's like in the 80th percentile. So we're not sure if the auditory neuropathy has affected one side more than the other. But once again, it's just good information as a parent to have, and the only reason that is that he's a sweaty little boy that loves to play football and wrestle, and so we sweat out our hearing aids a lot. And so if we are down a hearing aid, we know that his speech discrimination is significantly better in his right ear, so that if we are going to aid this one ear while we're getting one hearing aid fixed or while we're waiting for a loaner, we know to aid the right ear. So that has been some good information for us. But once again, nothing that would lean us to doing anything other than what we're doing right now, because his speech discrimination bilaterally with both aids on is 92, 90, sometimes up to 96%. So I don't really want to touch that. I will tell you that because being the guide by your side coordinator now and having experience of an AN child, I remember back when we got the diagnosis of AN, driving myself crazy, trying to decide, was he acting like an AN kid or was he acting like a kid with hearing loss? And was AN affecting him more, or was the sensory neural hearing loss affecting him more? And really what I told myself as a parent finally, after I got out of that like tornado whirlwind, was that we needed to treat how he was being amplified and how he was developing speech and language, or language depending on what mode of communication you choose. And it wasn't necessarily so much the diagnosis, but it was treating how he was functioning. And once I got beyond that, it seemed like it was much easier to deal with. Definitely have I seen some better hearing days than others with Anthony? Yes. But we have never seen such a good hearing day that he can't tolerate his hearing aids. He always wants his hearing aids and wants them on every day. If anything, what I see is poorer hearing days where sometimes his speech discrimination seems to be down, almost like if he had a cold, like a regular kid with hearing loss would maybe perform with a cold and their hearing is down. He sometimes performs like that without a cold, and so that's where we maybe think that the auditory neuropathy, but they're so few and far between that they don't impede on his daily functioning. Now, what I do see with some families currently that have little tiny babies that we're finding the auditory neuropathy much younger than my son, so maybe at 2 months of age, is that, and I'm going to leave this up to Jean to address as well, but parents are really challenged by brand new moms who have this baby, so the audiologist is thinking, okay, we want to try a hearing aid trial, but because we know it's in, we want to set it very conservatively, because we don't know if this, we have the ABR results, but now we need to get some, condition play results to really be able to have an idea of how to maybe amplify the child, because if they're having fluctuating hearing, you're not exactly sure how to amplify them. I do know of some moms that it's driving them absolutely crazy not knowing. Are they giving, are they getting enough gain on the hearing aids because we're setting them conservatively in order to be able to develop the language that the family is choosing. I know that one thing that we have started doing with a couple of our families is they're keeping daily journals, because the audiologist is so reliant on, what kind of responses is the family seeing. And I totally understand why the audiologist is asking for that information. However, I also know as a parent of 4 kids, that sounds a lot easier said than done. And so when, our days turn into like weeks pass by days and months pass by weeks, all of a sudden you're back at the audiologist's office and they're asking you, okay, so, what have you seen? What kind of responses have you seen out of your child? And you feel, bad because you don't have a good list. And so some of our parents are now just throwing a daily journal in their kitchen and they're journaling, some responses that they're seeing out of their young ones with auditory neuropathy. I also see audiologists in Indiana making recommendations for to bring the child in for more testing than the normal recommendation would be with a regular sensory neural hearing loss, so that they can see if they're catching any fluctuating hearing as well. And then many of those parents are utilizing the Auditory Neuropathy Yahoo group. I know that they found that to be a big benefit. And like I said, I still yet have seen Anthony had a very good friend that he went to school with, and boy, they just function so completely differently. And that kiddo just really got no benefit from his hearing aids and is now has bilateral cochlear implants and is doing well. But their journey, this child would plateau much quicker than Anthony was plateauing, and a lot of it was just the way the auditory neuropathy was affecting his language outcomes compared to how it was affecting my son. So at this point, I think I'm going to turn it over to Jean, and then there may be something that Jean wants me to include as a parent, but I think I'm going to turn it over to Jean now.
Okay, thank you. This is Jean Thomas, and I'm an audiologist, and I've specialized in pediatrics since I've entered the field. I have over 25 years of experience, and so one thing that tells you is that when I came into the field, we didn't know about auditory neuropathy. So I have learned while doing. And so I'll share a little bit, and then I'm going to make sure that I give everyone time for questions, because I'm sure that's what you would like to do next. I just wrote down some comments as I was listening to Lisa talking. One thing she mentioned was the specifics about auditory neuropathy or its diagnosis or how we diagnose that. I'm not going to go into that in a lot of detail because it could take some time, but if anyone has more questions in that area, I'd be happy to discuss that further. But basically, it's an insult in that inner ear. We have our outer hair cells and our inner hair cells within the cochlea. In auditory neuropathy, the outer hair cells are okay, but where we have damage is in the inner hair cells or its synapse, where it starts to connect to the auditory nerve. And it can be an insult in that area that then causes the auditory neuropathy. So the otoacoustic emissions is a test of the outer hair cells. And so when you have present otoacoustic emissions, it helps with the diagnosis. We have found, though, with experience in this past decade, that it's not necessary for the diagnosis, that the OEs, sometimes they're not there, sometimes they go away. And that doesn't mean things are getting worse. It just seems to happen. So it's not critical for the diagnosis, but it really helps us to make the diagnosis when we can record them. Some other thoughts that I'd written down. Talked a lot about variability, and I think Lisa talked a lot about that, and I think that that's very important and very true, that there's so much variability with kids with auditory neuropathy. And the behavioral audiogram that we end up with does not predict how the child is going to be doing. So you can't look at that audiogram like you can with a child with sensory neural loss and predict how they may do with their speech understanding. So a child with auditory neuropathy may show a moderate loss but have really severe problems with understanding speech. So there's no way to predict how these kids are going to do. One thing that we do see, though, among most children with the diagnosis is that they have poor discrim but very much more difficulty when they get into noise. So that is common across AN children. Another thing Lisa touched on was a diagnostic approach. And I'd love to hear her say that. I wrote it down and underlined it. You know, really what we've learned with auditory neuropathy is that there's not one clear answer for every child. And really we take a diagnostic approach to treating auditory neuropathy and to trying to find out what works best for that child and that family. We do need to try hearing aids. When we first when we first identified auditory neuropathy, our first thought as a field was not to aid because we thought we would hurt what outer hair cells were still functioning well, and so we thought if we put a hearing aid on, we're going to hurt outer hair cell function. So we didn't want to do that. But we've learned that it's much better to go ahead and try hearing aids with auditory neuropathy children because we do see that there is a good majority that do well with hearing aids. So we need to try that first. If we're then seeing that these kids are not doing as well, then we may look at a cochlear implant or another option. Perhaps parents want to change the communication mode that they've chosen. But what else can we do to maximize this child's auditory abilities? So we need to, as Lisa said again, treat how the child is functioning. So we really want to see how they're functioning. Is what we're doing helping? Is there something else that we need to try? We use a diagnostic approach where we have a team that's really looking and monitoring how the child is doing with hearing aids or cochlear implant. We have speech pathologists on our team, early intervention specialists, the parents, the teachers, and we try to regularly share information to really monitor how this child is using and processing auditory information. So I think those were my quick notes that I jotted down to kind of respond to, and I think I'm going to just go ahead and turn it back over to questions now. We're right about the 9 o'clock mark, so this will leave some good time for questions.
Do we just yell out our questions, or how does it work?
Yes, this is Carrie. If anyone has a question, feel free to speak up.
Jean, this is Stephanie. I had a question for you regarding children with auditory neuropathy who do get a cochlear implant. I guess I'm wondering two things. One, if there has been or looks like in the future there will be any way of identifying the site of insult. And then secondly, if the child has a cochlear implant and the site of insult was, say, the inner hair cells, would that mean that there would be that there would not be dysynchrony because the electrode array would be bypassing those inner hair cells anyway? And in which case are you seeing cases of children with a cochlear implant that are not experiencing greater difficulties in noise than, say, your typical sensory neural hearing loss?
Okay. There were a lot of questions embedded in there, so let me try to answer some, and I'm sure I'm going to miss some, and so we can come back to them. First of all, you were talking about site of lesion. Can we figure out where that is? Unfortunately, no, because the area that we're looking at can't easily reach that, can't easily image it. And so any studies that we do have that suggest possible site of lesions are really animal studies and some histologic studies. So it's difficult for us to figure that out now. In the future, I've learned that this field is constantly changing, and I don't doubt that in the future, perhaps, hopefully, we'll have better means to figure that out. When the site of lesion does involve the inner hair cells or the synapse with the auditory nerve, the cochlear implant the way it works is it bypasses that area of insult. And we find that the electrical stimulation provided by the implant can then produce synchronous firing. We know that with auditory neuropathy that the synchrony of those nerves, the auditory nerves, is impaired. They're not working together. There's lags. And so it causes, for those people with auditory neuropathy, they can detect auditory stimulus, but it doesn't make sense to them. There's enough distortion in that auditory signal that they can't understand that speech signal. So, and I'm losing my train as to what your next question was. One other question.
What I was trying to determine is in some cases with the cochlear implant, if the site of insult is not the auditory nerve itself, but along the periphery or especially the inner hair cell, if in fact the electrode array would bypass that site of insult and therefore contact with an intact nerve, since maybe it's not the nerve, it's just the inner hair cell. And in those cases with auditory neuropathy, I was just hypothesizing, would it be that, those children would not experience greater problems in noise than, like, in other words, are you finding a group of kids who have cochlear implants who, in fact, are doing equal in noise to regular sensory neural hearing loss kids with cochlear implants? As a subgroup within the auditory neuropathy, and maybe suggesting that that's because of the site of lesion.
Okay, that's a great question, and I haven't seen that in literature that I've read recently, and I don't have that information from my current clinical experience. One article that I can point to is some recent work by Rance. He's in Australia, and he does a lot of work in the area of auditory neuropathy. He's at the University of Melbourne. He recently looked at an analysis of auditory neuropathy kids that wore both cochlear implants and hearing aids, and he looked at outcomes for these children. This is a study published in 2009. Unfortunately, he didn't publish any outcomes in noise, listening to noise. His outcomes, he looked at speech and he looked at language. And he found that the children with auditory neuropathy with cochlear implants and hearing aids could develop spoken language skills commensurate with the sensory neural kids that got cochlear implants. And he found a good number, and I've seen him publish previous numbers of about 40 to 50% of children with AN that do well with hearing aids, and that other half then may do well with a cochlear implant. So, unfortunately, I don't have an answer for that. I haven't seen that kind of data yet, but that would be some good information to collect and to see published.
Thank you. I have a question, if I may.
Yes.
Okay. Hi, Jean. My name's Karen Ness. I'm an audiologist. I do oral rehab with early intervention. And there's actually a couple of questions I wanted to ask you. You had said that you did not think that you could predict the audiogram, the behavioral thresholds, and how well the child was able to make use of spoken language?
Yes.
Okay. All right. Well, actually, I wanted to ask about that, and maybe I'm trying to simplify things too much, but it seems to me the kids that I've worked with, I can almost tell immediately, whether or not they're making use of auditory information or not. And it seemed to me that there kind of was this trend around 70 dB, where the kids whose behavioral thresholds were about 70 or poorer really are not doing well with hearing aids. And it seems as if the kids whose auditory thresholds were better, there did seem to be a greater ability to make use of auditory information.
Mm-hmm.
So is that too simplistic? I guess, can I ask one more thing? Let me finish my thought in this. I almost wondered if that auditory thresholds are a bit of a barometer for maybe how significant the auditory neuropathy is. True or not true? And I would just like you to comment on that.
I would agree with that when you are talking about a child with auditory neuropathy that shows behavioral thresholds in that severe to profound range. If we see behavioral responses that are that poor, then that can accelerate that cochlear implant evaluation. You're going to assume that the hearing aids are not going to provide full audibility for that speech information.
Mm-hmm.
Now, I have seen children, though, that present with a behavioral audiogram in the mild to moderate range,
mm-hmm.
who we have ended up implanting because they did very poorly with their hearing aids. They did not get the auditory access that they needed to be developing their auditory skills and their speech and language abilities. And so certainly we have some children with cochlear implants that have a mild to moderate audiogram that you would never consider putting hearing aid on if they had sensory neural loss. So I see both sides of that. I mean, I think the one answer for auditory neuropathy is that there's such great variability that no two kids are quite the same. So I would hold with saying that if the child shows a severe profound behavioral audiogram, that chances are, yes, the hearing aids are probably not going to work as well, but you need to try them, but you're probably working towards an implant. And if you have a child with behavioral responses between a mild to a moderately severe loss, you really need to try the hearing aid. There's a good chance it may work, but there are some of those kids that the hearing aid does not work, and then you can go towards an implant. Does that jive with your observations then?
Yeah, but I also wanted to know that you're still at the point that kids who show hearing sensitivity within normal limits but still have a diagnosis of AN, those kids are not candidates for hearing aids. That's still the case?
I have not had personal experience with an AN child that showed a normal audiogram. They've always had, in my experience, they've always shown some degree of hearing loss on a behavioral assessment. I have not seen a child reported in the literature that had a normal audiogram and AN and received a cochlear implant. Hearing aids, you would probably move, instead of towards a hearing aid, you'd probably move more towards FM systems or something that could help that child in listening and noise, because the behavioral audiogram wouldn't support putting a hearing aid on, but it would support trying to help them in listening and noisy situations.
Okay. Thank you.
Hi, can I ask a question?
Yes, please.
My name is Ilona. I have a son. He's 12 months old, and he was diagnosed with AN at 5 weeks. And actually, he's the one who is actually showing a normal hearing. And he didn't hear anything for 6 months since he was born. And then we started seeing some responses. And when he started to be tested at 8 months, he was all the time in 20s. And then, but he had a lot of fluid in his ears. So when the fluid was consistent, they decided to do tubes. And after they did tubes, he's showing a normal hearing actually. And then he shows some he understands a simple words and a simple directions. And but the AN is still there, because when they did the tubes, it was actually June 28th or something, they repeated the ABR, and it's still there. So my question is, what would you do? What do you do in that case? You just do the therapy and then wait? Because they can, hearing aids, that is not a case. Somebody mentioned to me the FM system, but they said I'm supposed to wait a little bit. So I just want your opinion. What do you think about that?
One thing with auditory neuropathy is that we can definitely, there are documented cases, and I've experienced it myself, where there is improvement. So auditory neuropathy is diagnosed when the child is very young, and then we do see improvement over that first year, 12 to 16 months of life. And we keep that in mind when we're looking at a child and thinking about cochlear implant candidacy. The push is always early being better, but with these auditory neuropathy children, we do want to be a bit more conservative and not look at implantation until 12 to 16 months, because there can be improvement, and I wonder if that may be happening in your case, and it would be difficult for me to know for certain. Your audiologist could probably talk to you more.
Yeah. Because it was funny, even, I went for the last appointment, and the person who was talking to me, she thought, she asked me, when she, read the reports from the speech therapist and the oral rehab, she asked me, did you repeat the ABR? Because that was on her mind. And I said, yes, I did. So, I don't know. So you say it may take, 2 years to get better?
Yeah, if you're seeing you can see recovery from auditory neuropathy, and it can be a slow thing. And typically, we feel that it's been shown in research in some of the studies, but typically, if we're going to see improvement, we're going to see it by 12 to 16 months.
Okay.
Now, what you can be doing right now is to continue with the early intervention, continue to closely monitor his speech and language and his auditory skill development. That's going to be really critical, because you want to see him keeping up with his peers in terms of his development. And if you're seeing him lag behind in his auditory skill development or his speech and language development, then you want to beef up the early intervention therapy in that area and try to keep him at an age-appropriate level.
Yeah, he still has, he gets the oral rehab and he gets the speech, and so they say he's doing actually, right now, but, we don't know if he's going to keep up, but right now they said he's doing everything what, the 12-month-old supposed to do, and he was a little bit, premature, just 5 weeks or something, so, yeah. So it was interesting, you mentioned, that you never, work with a child like this, and then, the other thing is, we don't know it's going to stay. He was kind of pretty consistent since March, always in 20s when we tested him, every 2 months. And then somebody mentioned, more testing. Do you think it's necessary in his case to see? Because, he never showed, the fluctuation, even when I tested him, every day for, link sounds or something, since he, got better, you know what I mean? For sure, the first 6 months there was no responses. So, and then like the noise, and the other thing is that it doesn't seem like the noise bothers him at all. Like he loves music, like, and then when I talk to him, he's okay. Like he's not like, you know, he loves it. Like he dances to it. So I don't know.
That sounds wonderful. I'm glad that he's doing so well, and I would continue to closely monitor that. You know, since he's had that diagnosis early in his life, follow it throughout that first 3 years closely, and you know, make sure that he's keeping pace with his auditory speech and language skills. So, yeah.
Thank you so much.
Oh, you're welcome.
Question, please.
Yes.
Yes. My wife and I, we had our son. He was born in January 9th of 2011 here, and he did not pass his OAEs out of the hospital. So we continued to follow up, and at 3 months of age, we had a ABR test done at Lutheran General, and the results were inconclusive. She did not really. She's like, well, I don't really understand the results here. She's like, I recommend waiting another month, having another ABR done. So that's what we did at 4 months of age, and we had a normal pregnancy with a C-section. At 4 months of age, we had another ABR done, and from a different specialist. And she said, you know what, he might have AN, but I'm not really quite sure because the readings are confusing. So it was at that point that we decided to contact UIC and pursue it further with specialists, with Dr. Suskin. And we saw Dr. Suskin and had a sedated ABR done at 5 months of age. And they said, well, you know what, there's a possibility he might have AN, but we're confused also because he had a wave 5 form all the way down to 30 hertz. Although the delay was not normal, because as it goes down in hertz, the delay on a wave 5 should get longer and longer for the response. And the response was a slow delay. It wasn't nowhere near a normal delay, which they'd like to see. So we sent the results out to Dr. Berlin. Dr. Berlin reviewed them and said, you know what? I really don't believe that he has AN, that it's just a sensory, neural hearing loss.
Yes.
So at that point, at 6 months of age, we had another behavioral test done from UIC, and he dramatically improved. Beforehand, from the behavioral test, he was responding to voice and music to about 35 or 40. And different waveforms, it's like 40, 45. So at 6 months of age, we had another behavioral test done. Music and voice, he was responding down to 20 hertz now, or decibels, I should say.
Right.
Decibels. And 35 on the other various waveforms. So there was an improvement. And they said, well, we believe it's more of him understanding what he's hearing, more so than his hearing is improving. So we sent the results from there out to Dr. Hood, and Dr. Hood just came back and said, Dr. Linda Hood, she's like, well, you know what, I don't believe, in my opinion, I agree with Dr. Berlin that he doesn't have AN, but he may have a delayed neural maturation. What exactly does delayed neural maturation mean?
Okay. The ABR is a test of neural synchrony. So how well is that auditory system working that past the cochlea? Okay. You can have an issue where the maturation, the myelinization within the auditory pathway is delayed for whatever reason, and that would be a good thing to talk to your doctor about. So when there's delayed maturation, delayed myelinization, then the ABR can be abnormal. And as that maturation and that myelinization improves, then the synchrony is there, and we're better able to record the ABR response. So the cochlea So it's a little bit like auditory neuropathy, but not, it starts out that way, but then it may be one of those cases that we talked about where we saw improvement. So the cochlea is operating normally, but the ABR really depends on synchronous firing in the auditory pathway. And so if something's impacting that synchronous firing, whether it be auditory neuropathy or just a maturational effect that's going to improve with age, they're both going to give us that unusual ABR.
Here's some questions too. Okay, the specialists have been telling us that. Well, first of all, when he had the sedated ABR at 5 months, since he failed it, they did an MRI of his head there, and all the nerves, 7 and 8 or 8 and 9, I believe, showed there was no problems with them. The inner ear all looked good. But he's still not passing his OAEs to date. I mean, he passes some, but not all of them, and it's all, or it's pass or fail test.
Yeah. Otoacoustic emissions can be absent in someone with normal hearing because they're very easily impacted by the status of the middle ear. So if there's a little bit of congestion present, that can make the OAEs absent. So we can see absent OAEs when we can test and, get results that tell us normal hearing. So the absent OAEs doesn't...
Even from day one, I mean, it's been 7 months now, and the OAEs are still absent?
Every single time.
Every single time?
Yeah. That's, it's going to be a hard one for me to answer without really having the full audiologic chart in front of me. It's a difficult one for me to answer for you. But, I can tell you that OAEs can be absent and have normal hearing. And typically, you would expect the OAEs to be there in a case of auditory neuropathy.
Is what they recommended, and that's what my wife and I both decided, was to not take and do hearing aids as time amplification, because they're like, let's see, now at 9 months of age, we're going to have another, behavioral test done and see if he improves again, because the first two at 3 and 5, he stayed the same, and then at 6, all of a sudden there was an improvement.
Yeah. What I would be also doing to supplement the audiologic evaluations you're having is to get a very thorough evaluation done of his auditory skill development and his speech and language development, and see if that is lagging behind or is he keeping
we got EI for hearing, for vision. I mean, we got EI for everybody, and and he's only 7 months, so. We've already seen all these people, and we got weekly visits, and they say he's developing normally at this point. There's no signs yet.
Great. So I think you're doing all the right things and keeping all those specialists on board with you and keeping up with those, evaluation and monitoring intervals. That's really important. I think you're doing everything you can for him, and he's showing that he is developing in those skills. So keep up with the audiology follow-up, too, to hopefully see further improvement in that area. That would be my thoughts without seeing all those records.
One more question, too. They did a middle ear reflex test, and all that came back fine, too. So how does that come into play with all the rest? And my feeling is, he's 7 months old, even though all these specialists are saying the inner ear, middle ear is all developed at 26 weeks. The nerve system is always developing, as we get older.
Right.
So the first question is, the reflex in the middle ear was there, and there was a response.
And typically it's absent in auditory neuropathy.
Okay.
Well, the classic auditory neuropathy audiologic findings are an absent ABR, no wave size, a present cochlear microphonic, that's a component of that ABR waveform. It's a very early waveform that arises from the outer hair cells. You have typically normal otoacoustic emissions and absent middle ear muscle reflex.
So have you ever seen AN with an individual that had no OAEs they had the inner or middle ear reflex. Has there ever been a case documented like that? And a wave 5 form present but not delayed normally, because as the tongue goes down, it's supposed to be delayed more, and there's a slight variance, not normal.
I think the presence of wave 5 would rule out auditory neuropathy, and then I think you might be looking at a maturational issue. So I think presence of wave 5 certainly you would not see with auditory neuropathy.
Okay. All right. Thank you very much.
Certainly. Lisa, do you have any questions or comments?
Well, I was going to comment just on that, and I know both parents spoke of, it's just the unknown is so hard, and I know that exact feeling, and I hear it from parents time and time again. But when you're down the road, and as I shared my story that my son's 11 now, and where he's at in his education and his journey. Now I look back and go, oh, I get it. The most important factor during all of that was closely monitoring his current functioning level. So, Jean, you said it, I think both times, and although the diagnosis may not be exactly on par, the most important piece that we have is making sure that they're enrolled in early intervention, that they're being closely monitored for their language development, and if you start seeing them start fighting their language development compared to typically hearing children, then that's when red flags really go up. But more importantly than ever, than knowing that exact diagnosis, is making sure they're hitting those auditory and language milestones. So,
I totally agree. Thank you, Lisa.
Hi, Lisa. This is Stacy from Children. When you were talking, you were commenting about encouraging parents to keep a daily journal, and then I missed what you said about AN Yahoo. What is that?
There is an auditory Yahoo group.
Auditory
Neuropathy Yahoo group. That's where lots of parents find Dr. Berlin and Linda Hood, and are able to. We have a family, just like the gentleman that just spoke, we have a family here in Indiana that has sent off all their test results to them as well.
Okay.
They periodically jump on that AN group and will answer parents' questions. So.
Okay. Thank you.
Well, we have a couple more minutes left before we hit that hour mark. Is there any last-minute questions? Okay. Well, I want to thank Lisa and Jean for volunteering.
I'm sorry, I unmuted. I wanted to ask about how people access that Auditory Neuropathy Yahoo group.
I think if you just go, this is Lisa. I don't have it up right now, but if you just go to Yahoo Groups, and then you can put in a type of Yahoo group, and you put in auditory neuropathy, that group will pop up.
Okay, thanks.
Yes.
Yeah, there's a variety of Yahoo groups. I know there's CI Circle and so forth. So I'm sure a lot of parents can jump in with many more out there. But they're fantastic. There's even one for atresia microtia. So. But again, thank you to Lisa and Jean for volunteering your time tonight. I truly appreciate it. You have made this call possible for us to learn from each other and for us to openly share. And keeping that in mind, I know we all have our personal experiences with professionals, and just it's part of our journey. And keep in mind that one person's journey is very different, as Lisa had shared, from someone else, and that goes to their working relationship with professionals as well. So please, if anyone has learned anything from tonight, that, again, we all have different journeys, and, just take it one day at a time, and we're all here to support each other. So, again, thank you for your time. Thank you for hanging out with us this evening, and I look forward to catching you next month.
Thank you.
Thank you. Thank you.
Thank you.
Good night.
Thank you. Thanks, Terry, for organizing it.
No problem.
Thank you.